Let's get into the Black History fact of today. We are going to talk about the mothers of gynecology. If you guys do not know, women, if you do not know, the simple task of these medical procedures in gynecology, it has happened in these treatments because of three enslaved black women. Let's talk about these queens. So, Anarcha, Betsy, and Lucy, they were three enslaved women who lived and worked on different plantations near Montgomery, Alabama in the 1840s. All three women developed a painful medical condition after childbirth that caused them to lose control of their bladders and bowels. So, enslaved women with this condition were kept apart from the other workers. There was no cure. Anarcha, Betsy, and Lucy were told they would have to live with the pain and shame of their injuries for the rest of their lives. So the men who enslaved the ladies were frustrated with their condition. They wanted to find a cure not because they cared deeply about the enslaved women, but because the woman could no longer do the labor that would earn them money for their enslavers. So in 1844, all three enslavers sought the advice of Dr. J. Marion Sims. So, like many doctors in the 1800s, J. Marion Sims was very interested in medical development and advancement and experimentation. So, he practiced all kinds of medicine from dentistry to pediatrics to general surgery. So, in 1835, he moved from South Carolina to Alabama after two of his patients died. Eventually, he settled in Montgomery County, where he came to the attention of the man who enslaved the ladies. So, Sims had recently discovered a new way to position surgical patients. He believed he might be able to cure the ladies within 6 months. He made arrangements with their enslavers to lease the women for the duration of their treatment. So, he had complete control over their bodies. It is unlikely that the ladies ever had the opportunity to consent to the experimentation they were about to endure. Lucy was the first of the three women to undergo Sims' experimental operation. The operating room was packed with doctors who wanted to watch the procedure. She was not asked about whether she was comfortable with strange men watching her operation. Lucy was brought to the operating room naked and restrained to the table, so her involuntary movements during surgery would not disrupt the procedures. Sims did not use any anesthesia to numb her pain. This was partly because doctors feared patients could die from anesthesia, and partly because it was commonly believed that black women did not experience pain the same way white women did. Lucy's surgery took about an hour, and she was conscious for every minute of it. That is so cruel. After the surgery, Lucy developed a terrible infection from a device Sims had placed in her bladder. She experienced days of extreme agony. Sims was able to cure her infection, but her injury did not heal. The operation was a failure. It must be acknowledged that these advancements were made through the exploitation of enslaved women's bodies. So Betsy was the next person to undergo Sims' operation. So, like Lucy, Betsy was naked on the operating table and not given any anesthesia. This time, Sims used a device he invented for her bladder, and Betsy did not experience the same post-surgical infection that Lucy suffered. But Betsy's injuries was not repaired, and this operation was also considered a failure. Anarcha was operated last and had the same results as the other women as well. So, when the results of Anarcha surgery became widely known, the local medical community decided that Sims was a failure and stopped supporting his experiments. The three ladies were left in Sims' control because without a cure, they were considered useless to their enslavers. They worked for the Sims family in the periods between their procedures and recovery. Sims decided to carry on with his experiments even though all of his white male assistants quit. He trained the three ladies to be his assistants during operations and taught them how to care for each other during their recoveries. Separated from their families and communities with medical conditions, they made them social outcasts. The women had no choice but to continue cooperating with Sims. In time, they became skilled medical practitioners in their own right. So Sims experimented on all three of them for the next 5 years. He also brought in other enslaved women to experiment on. He had no shortage of patients because enslaved women did not receive proper care during pregnancy. Sims bought one patient because her case was unique and her enslaver was not willing to risk an investment on experimental surgery. Sims practiced his procedure on a total of 12 women, but only named Anarcha, Betsy, and Lucy in his published reports. In the summer of 1849, Sims performed Anarcha's 30th operation. He used all of the new tools and techniques he had developed over the last 4 years. This time, Anarcha's injury finally healed and she made a full recovery. Shortly after perfecting his technique, Sims closed his hospital and moved to the north. Anarcha, Betsy, and Lucy all returned to their enslavers after 5 years of absence and experimentation. In 1852, Sims published an article that outlined his new procedure. To appeal to a wider audience, he never mentioned that the women he operated on were enslaved or that he had total control over their bodies. He also never mentioned that the enslaved women became skilled medical practitioners. In the illustrations that accompanied his articles, he is shown operating on white women with the help of a white nurse. The patient is also covered, a token of respect that Anarcha, Betsy, and Lucy never received. Sims' work and article revolutionized surgical treatments for women and earned them the nickname the father of modern gynecology. But it also must be acknowledged that these advancements were made through the exploitation of enslaved women's bodies. So some historians have argued that Sims' patients became enthusiastic participants in his experiments, but is it important to remember that they had no choice? Anarcha, Betsy, and Lucy, and all of the unnamed patients of J. Marion Sims deserve to be remembered as the mothers of modern gynecology because without their labor and pain, Sims' critical achievement would have not been possible. Say their names.